So fallopian tubes can become mildly or severely blocked due to mucus, scarring or adhesions. And this may actually occur at either end or in the middle of the fallopian tubes. And blocked fallopian tubes are actually responsible for 20% of cases of female infertility and can also increase your risk of ectopic pregnancy. And this is because the fallopian tube is actually blocked and prevents the fertilized egg from traveling to the uterus, and instead it implants in your fallopian tube or maybe elsewhere in the abdominal cavity. So why does this fallopian tube become blocked, and why is that so common? The reason is because the fallopian tubes are very, very tiny, very narrow, measuring only 10 centimeters or 4 inches in length, and they're only as wide as a regular strand of spaghetti. So inside this 10 centimeter long strand is a narrow passage the size of a sewing needle. So the mature egg needs to get through this tube is roughly the size of a full stop, and that it's so small that it can easily, and the tubes can easily block it from going through. And that's because the fallopian tube actually contains mucus, and it's there because it's there to slow down the passage of the egg, to give the endometrium more time to thicken to sustain implantation and pregnancy, which I think is very clever. However, of course, any mucus-producing organ can actually become blocked. Just think about your nose. So this mucus can become thick for many reasons, and that could be dehydration or your diet from eating too much mucus-producing foods such as dairy, or taking pharmaceutical drugs and drinking coffee and alcohol, again, because they're diuretics. And smoking and infections. Some more serious reasons for blocked fallopian tubes may be traumatic vaginal birth or a C-section, endometriosis, and autoimmunity. So because some of these cases, these causes, they can actually lead to scarring and adhesions, which can then pull on and distort the fallopian tubes, in which case they may actually need to be removed. Procedures including a hycosi, which is a histosalpingo contrast sonography, where fluid is injected through the cervix, and ultrasound scan is actually used to see if the fallopian tubes are blocked. So this procedure can also be used to treat fallopian tubes when rinsing them with saline solution. And so then once the initial cause of the blocked fallopian tubes has been identified and addressed, it's actually medically applicable to treat naturally. And the natural fertility approach focuses on preventing recurrent infections, strengthens the immune system, and also minimizing scar formation. And we do that through adequate nutrition, infusionist circulation to the area, massage, and pelvic floor exercises. And nutritional and herbal therapies can be beneficial in mild cases of scarring and blocked tubes. And some manual therapies have actually been shown to help even for very severely blocked tubes. So the diet that can help you with blocked fallopian tubes, so reducing your mucus-producing foods such as dairy and soy, avoiding your allergenic foods such as yeast, dairy, soy, wheat, and all other foods that you're allergic or intolerant to. We want to avoid coffee and alcohol. You want to drink 2 litres of purified or filtered water per day. You could increase your intake of garlic, which can naturally help prevent bacterial infections. You can increase cinnamon, ginger, and cayenne in your diet, because that will actually help to improve the blood flow to the uterus and help to break up any congested mucus. And also nutritionally, a combination of spirulina and chlorella or green tea will help to remove the body, that removes your toxins from the body and also repair tissues. Some lifestyle recommendations for blocked fallopian tubes: if you're smoking, stop. Have acupuncture treatments, because they help to move the energy and blood and mucus around the body. Also having an abdominal massage, or use a self-massage video at home. Exercise will help you improve your circulation. I recommend doing yoga, and also see a naturopath or herbalist to get suggested herbs that are prescribed professionally for your individual situation. And also castor oil packs can help to break up the scarring.